in this episode. So how should our dental photography equipment be? Let us talk about dental photography using a phone first. If we actually go by the statistics, phone is the second most contaminated thing that we touch daily. Let us see the pros and cons of a professional camera, which could be a DSLR or a mirrorless camera. When you are using a professional camera with the right lens, you know where to stand. So I hope this episode could be helpful for all the people who are wanting to know an overview as to what equipment might be good for them. You're listening to the Dental Photography School podcast, where I'll be sharing practical tips on clinical and general photography. I'm Dr. Mayur Dauda, and I've been coaching dentists and dermatologists on clinical photography since 2013. If you don't want to miss out on any action, make sure to subscribe to my show because I release an episode every Saturday morning. I've been teaching dental photography since 2013. Since then, a lot of people have contacted me and asked me a lot of questions, but I would say that 80 to 90% of the questions would be on dental photography equipment. So how should our dental photography equipment be? For me, I think it's quite a personal choice, and the choices would keep on changing depending upon the phase or time of your life. I believe if I were a student, I probably want to think about doing dental photography using a phone. And if I was an early practitioner, I would be in between. I'd probably be confused whether I should continue doing dental photography on the phone or whether I should actually invest on a professional camera. So it does narrow down to our personal choices. So how should our dental photography equipment be? An ideal dental photography equipment would be such that it gives us high resolution pictures. It should exactly replicate what is present in front of us. It should have no distortion. It should not have any noise or grains. In other words, it should give us more clarity. It should be really sharp. It should give us consistent pictures in the sense the recurrent pictures should be similar over a period of time. Number 7, it should be easy to use. And number 8, it should be economic. Now, we all know that dental photography can be pursued either using a phone, because phones do have great cameras nowadays. So dental photography can be done using a phone as well as a professional camera. So let's just divide this into 3 different categories: dental photography using a phone, dental photography using a DSLR, and dental photography using a mirrorless camera. Now it's completely our own personal and individual choice what we want to use to document our cases. So let us discuss the pros and cons of each and every system. And probably by the end of this podcast episode, you might have more clarity as to what is ideally suitable for you. Let us talk about dental photography using a phone first. So what are the pros? The pros are it is easy to use, yes, and there is no learning curve, or there's a very short learning curve. And it's definitely more economic. It's more available in the sense you always have your phone with you or on you. So it's very easy for us to get access off the phone and do any kind of photography. It has relatively good pictures nowadays because the phone cameras do give us high resolution pictures nowadays. So what are the cons? The cons are it is going to give us a lot of distortion. So we are not going to get into the specifics of why distortion is happening, and we're going to be seeing that in our forthcoming episodes. But yes, when we use our phone, we are going to get a good amount of distortion. So if you do not want to have distortion in your pictures, and if you actually want to replicate what's exactly present in front of you, phone is not really a good choice. When it comes to asepsis, it's not a great choice. We do carry our phone almost everywhere, and if we actually go by the statistics, phone is the second most contaminated thing that we touch daily. The third thing is that phones do give us a relative amount of blurring, which could be possible because of two reasons. Again, I'm not going to be going into the details of it in this episode. This episode is more about giving you an overview of what equipment might be a good choice for you. So yes, there are a lot of reasons why a phone could give you blurred images, and we'll be speaking about it in detail in our forthcoming episodes. Compared to a professional camera, a phone's resolution is way more lesser. It does give us a lot of noise. Phones do give us a lot of grains. And there is no way to achieve consistency over a period of time. In the sense, if the patient is coming to us after a week or a month or a year or say 3 years, there is no way where I can get consistent looking pictures using a phone. There is hardly a chance of getting standardized pictures, which is one of the biggest drawbacks of using a phone for dental photography. Apart from that, we actually need to think how the patient is going to think about us when they see us documenting our pictures using a phone. I'm sure the patients might not really think good of us because nobody would want to see that a doctor is documenting a particular case using a phone. On the contrary, let us see the pros and cons of a professional camera, which could be a DSLR or a mirrorless camera. So what are the pros? If you keep your settings well, you are going to get very minimum noise, very minimum grains, no distortion, and it should exactly replicate what's present in front of us, in addition to giving us high resolution pictures. And there is a very high chance of getting consistent pictures over a period of time. Apart from that, using a DSLR does make your patient think quite good of yourself. It does look quite professional. It looks very respectable. I'm sure all the patients who might see a dentist or a dermatologist using a camera, a DSLR camera, would think highly of that doctor, because apart from doing their medical job nicely, I'm sure they would be proud to see that the doctor is capable of taking great pictures using professional cameras. So that's a huge plus. And believe it or not, it does affect the mentality of the patient quite a bit. It does make a difference if on the consultation table the patient sees a phone or the patient sees a professional camera. It does make a huge impact. One more thing that you need to consider over here is when you are doing documentation using your phone, you are not going to get a lot of accessories that are going to be really helpful for you. And even the accessories that you might get might not be really that great to give you results as comparable to a DSLR. Absolutely not possible. So that's way out of the league. In fact, there is no comparison. Let us see what all challenges one would face if they are using a mobile phone. Number one, they could suffer from improper lighting. That's because the mobile phones actually do not use a flash. So what the light that comes out of a mobile phone is, although it's called as a flash, it's not really a flash. It's a continuous light source. In other words, it's an LED. So the lighting is quite improper in this sense. It's going to be quite concentrated in the center, and as you go towards the periphery, it might dull out a bit. It might be quite dark. So even if you buy something called as a ring light for your mobile phones, the results are going to be very, very different from what you get it on a professional DSLR. So there's no guide for your position as well, in the sense where you're going to stand in front of your patient is something that you cannot answer if you're going to be using a mobile phone for documenting your cases, whereas there's a very clear guideline as to where you would be standing when you are using a professional camera with the right lens. You know where to stand, which is something like a huge drawback for me. And this one reason why DSLRs or mirrorless cameras are way, way, way ahead of mobile phones. In fact, it's one of the main reasons why I do not suggest my listeners to use mobile phones, because you really don't know where to stand in front of your subject. How far from your patient are you going to be standing to take a good picture? And how about over a period of time? If the patient is coming to you after a week or a month or a year, how are you going to achieve that consistency with respect to distance? How much distance you are going to maintain from your patient or your subject? There is no clear-cut guideline for it, and that is one of the biggest drawbacks of using mobile phones. And because of inadequate flash power, again, let me reinforce that it's not a flash, but people are used to saying that it's flash, but mobile phones do not have a flash. But because of inadequate flash power or the LED power, what's going to happen is the settings are going to be such that it's going to give you a shallow depth of field. Again, I'm not going to be speaking a lot about depth of field in this episode. We're going to be seeing more of specific points like the depth of field in our forthcoming episodes. But you need to take it into consideration that you might get blurring in the background, in the sense if you're taking a full arch picture, the entire arch is not going to be sharp because of shallow depth of field. And that is one huge factor that you need to consider before you decide on what is the right equipment for you. For people who think mobile phone photography is easy, let me tell you, it's way more simple to do photography, dental photography using a professional camera. It is just that maybe right now you don't know how to use a professional camera, but once you know how it's supposed to be used, what is the right technique to use it, there is much less delay. In other words, you're going to be way more quicker using a professional camera to document your cases as against your phone, which does have a significant amount of delay because of autofocusing. It's just that you should know how to use the DSLR in the right way, and if you know that, you're going to be way more quicker as compared to mobile phone photography. So I hope this episode could be helpful for all the people who are wanting to know an overview as to what equipment might be good for them. Again, to summarize, for people who would want to go for something easy, something that's readily available, something that's economic, something that they do not want to spend on separately, something which does not have a learning curve, something that gives you distortion but you are okay with the distortion, if you're okay with the noise, if you're okay with a little bit of blurring, if you are okay with a little bit of asepsis, if you're not really bothered about asepsis, if you're okay with the inconsistency of pictures, if you're okay with low resolution, then mobile phone might be good for you. But if you're someone who is really looking forward to do good documentation, who wants high resolution pictures, who wants no distortion whatsoever, who cannot compromise on image quality, someone who's looking for consistency, someone who demands respect, and someone who feels that their equipment does reflect in their professionalism, Someone who wants sharp pictures, someone who wants more accurate pictures, someone who wants to learn from their pictures, someone who wants details in their pictures. I think you already have your answer, and the answer is you have to invest on a professional camera, be it a DSLR or a mirrorless camera. We'll speak about individual choices in our forthcoming episode. That's all we have time for in this episode. If you're getting benefited from my tips, do show your love by leaving a rating and a review. For tutorials on photography, do check out my channel Dental Photography School on YouTube. To participate in contests and live events, join the Dental Photography School Facebook and Telegram group. You can follow me on Instagram as Mayur_EOS Maestro or Dental Photography School. I'll meet you next week. Till then, keep listening, keep sharing.